We're going to discuss thrombotic thrombocytopenic purpura, or TTP for short. So let's break down the words. Thrombotic just means that there's a lot of thrombi formed, little bitty thrombuses or blood clots. Thrombocytopenic means once you get all these platelets consumed in these little clots, then there's not enough platelets left over in the blood and you have increased bleeding other places. And then purpura is referring to the little purplish discolorizations that happen because we don't have enough platelets. So on the surface of the skin, you'll see little purple discolorization. So that's purpura. There's a couple different categories that lead to this TTP for short. Immune-mediated thrombotic thrombocytopenic purpura. This one, maybe after a virus and maybe a little more common in kids. I guess the demographics are kids and older women, or middle-aged to older women. And with this one, you get antibodies that are made towards a specific enzyme, and this enzyme is called ADAMTS13. And this is a metalloprotease that actually breaks down von Willebrand's factor, which is something that stimulates blood clotting and platelet aggregation. So if you have some kind of injury to your endothelium, the underlying von Willebrand factor will kind of expose itself, and that gets platelets adhering to it and to each other through a platelet reaction. And you want to clear that, and you clear it with ADAMTS13. It's a metalloprotease that clears it out. So if for some reason you're either deficient in this or you have antibodies that are inhibiting this enzyme, you're going to have the balance shift towards this von Willebrand factor being exposed, and it kind of finds its way into these little small blood vessels. And that's where we get the microangiopathy part of this pathogenesis, is that it gets there and then platelets adhere to it. And you get these little microthrombi, but they're already in this little tight space. Red blood cells have to kind of squeeze through those tight capillaries and stuff anyways. And when you have all these little microthrombi, it shears them and literally cuts them in half. It's called a schistocyte. You can see this on a blood smear where it just looks like kind of a half of a red blood cell. So that's one cause, is inhibiting this enzyme. The other cause is congenital. So they just don't make enough of that particular enzyme. So that's kind of the two categories. So with TTP, or thrombotic thrombocytopenic purpura, you have a mnemonic called FAT-RN that gives you it's a pentad, so it has 5 different main sequelae. So F for fever, A for anemia. This will be a hemolytic anemia. You know, you have those red blood cells, they're shearing into those microthrombi, and so you end up basically kind of opening them up. And you know, you would see a lot of LDH, lactate dehydrogenase, in the blood because of all these red blood cells just kind of falling apart. And T for thrombocytopenia, or low number of platelets. And then renal dysfunction. You get, with all this blood kind of getting lodged up in these capillaries and stuff, you can have some hypoperfusion to the kidneys, and so we know that can injure the kidneys. And then neurologic. So neurologic, just being mainly an altered state of consciousness, would be the main thing. But it can also lead to even, like headaches, and then it can even progress to like seizures and a coma if it progresses far enough. So some other symptoms you might have is just increased bleeding. Besides the purpura showing up in the skin, you might have epistaxis, which is a nosebleed, or you may have gingival bleeding, like brushing your teeth, you may notice more bleeding there. So that is thrombotic thrombocytopenic purpura. Now I want to talk a little bit about a similar syndrome. This one's called hemolytic uremic syndrome. So let's break down these words. Hemolytic, because again, we're going to have these little thrombi formed. It's a similar process, and then it shears the red blood cells and forms schistocytes, and so that's hemolytic. It's destroying those red blood cells. And uremic, because this one tends to, a lot of those little thrombi form within the kidney itself and causes more acute kidney injury. So that's why uremic is in this. It's a little heavier on the kidney side than TTP is. And so it's actually this one you see a lot in kids after a bacterial diarrheal infection. So they'll have bloody diarrhea, and maybe about 5 days later you start to see these symptoms kind of come into play. And usually the bacteria that's the cause is either Shigella or E. coli, and they both produce the Shigella toxin, and that's what stimulates this process. So the difference is, you have a triad with HUS, hemolytic uremic syndrome, and that is anemia, thrombocytopenia, and renal dysfunction. And then I have asterisks here by the two things that set this apart from TTP. So TTP adds in fever and the neurologic signs. And so as far as treatment, the first treatment typically is plasmapheresis, where you just exchange the plasma. So it'll kind of separate the plasma out, and then you'll bring in, like donor plasma in. Or rituximab, if it's ITTP, rituximab can decrease that antibody production. So rituximab is a monoclonal antibody itself. And then steroids, steroids have a lot of side effects, but it can at least suppress the immune system. And then dialysis, depending on how bad the kidneys get. So just to kind of review, Thrombotic, thrombocytopenic purpura, it has two classifications. It's either immune-mediated or congenital, but the key enzyme here is ADAM TS13, and because it's not breaking down enough von Willebrand's factor then causes these little microthrombi to form in the smaller vessels. That's called microangiopathy, and you get all 5 of the fat RN symptoms. Whereas hemolytic uremic syndrome, typically in children after a bacterial infection, a bloody diarrhea infection with either E. coli or Shigella, and then they develop more kidney dysfunction as well as the anemia, hemolytic anemia, and renal dysfunction. Thank you.